Um, Hello everyone, thank you for joining us. And I'm representing the group Outbreak Intel. My name is Abraham Magbakan, and I'll be going through our slide deck today. So we're able to come up with a app that's called Care AI, which is a AI-powered healthcare application that leverages AI to detect outbreak faster, and which by detecting faster will tend to save lives. So the team members are Mudashiru Murufat, which are communications. Miola is our project manager. Chinoza is our UI UX researcher. Joshua is our data analyst, and myself, Abraham, the software developer. So why this matters? So infectious disease outbreak in Nigeria are excavated by delayed detection, poor surveillance, and overwhelming clinics. Vulnerable populations lack access to timely, accurate health guidance. So why we decided to the AI chatbot for initial diagnosis. So that's why we decided to build this app to be able to detect outbreak, diseases, symptoms for various illness on time and give the user an idea of what's wrong with them and encourage them to seek professional help for further treatment. So the key feature of this app is going to be real-time symptom assessment. So the assessment is going to be real time, more interactive. What's wrong with you? You have headache, you have cold, you have this. The information the app will want to get from you and the feedback that the user will be giving back to the app is just going to be in real time. Then there's multilingual support, which means that we have this app in multiple languages and including our local dialect so that not only people in the big cities are going to have access to it, people in the rural area are also going to have access to this app, and we will to communicate and understand the feedback that the app will be giving to them because it will be in their own local dialect, which is something they will understand clearly. So there's also going to be a data integration with public health dashboard, which means that in our database, a backend database, we are going to integrate our database using some API calls with public health database where we can get real-time information of updated illnesses, updated symptoms for various diseases, new infectious outbreaks, and the rest. So the steps, how users will intend to use the app. So the steps are user report symptoms via chat boots. Like I said, there's going to be a communication with the application and the user, where the user will be asking some questions and the app will be asking some questions and the user will be giving back feedback. So the next step is that the AI will assess the risk level, either it's a low risk, medium risk, or high risk, depending on the symptoms and the communication that you have with the chatbot. Then this analysis will be escalated to clinics and logs data for outbreak tracking. So this means that the report is going to be given to the user to tell the user that this is wrong, this is what is wrong with you, this is what we believe is wrong with you, and this is what we believe you should do, which is to seek professional health care. But in severe case, we are also going to alert the major clinic closest to that person location. In the case of an infectious outbreak, we will report to the necessary authority to let them know that there's a user which might be having the symptoms of the infectious outbreak, and they can act accordingly to provide immediate healthcare to this person. So yeah, various screenshots for the applications. It shows the feedback, the data that the user will be inputting into the application, the diagnosis from the AI tool, and a brief chat log of the communication between a user and the chatbot. Then also there's a user profile page attached here. So our KPIs and impacts, which will measure how successful the app has been, or how we plan, or how successful we plan for the app to be. By January, we expect the app to have a 10,000 active users adaptation, which means that 10,000 people should be using the app by January, and by July, we want to have a 30% faster outbreak detection. That means we want to improve the app to be able to detect outbreaks and infectious disease faster, by 30% more faster than the first version of the app is going to be. Then by December, we also want to have a 85% diagnostic accuracy. That means for every query or diagnosis that the app is going to do, we want to ensure that the app is 85% accurate. So this is our KPI, and this is how we plan to measure the success of the app this year. So what are user saying? One of the users said that the chatbot disclaimer clarifies it's not a replacement for doctor, and that is very true. The app is not going to be a replacement for professional consultations and doctors. It's just going to be a guide to guide users on symptoms that you're having, what they might probably be suffering from, and how they can take care of themselves and access medical care. The other feedback from the user says that saving past symptoms history will be helpful. Yes, we plan to incorporate that feature into the app where you can save past symptoms. So the application using the AI feature can scan back to previous features that previous symptoms that the user has reported before, and which will also guide the AI to be able to make accurate prediction of what the user might be suffering from at the present time. So these are ethical safeguards which for responsible AI use, like the user was saying that the app is not a substitute for professional care. That's just it. It's just a guide, a diagnosis tool to help you understand what's wrong with you, why you're having those symptoms, and what you can do about it. So it's not a substitute for professional care. And offline mode, SMS fallback for rural users. Yes, we plan to do an offline mode, probably using the SSD to have that initial interaction with the user where they can relay the symptoms they're having, and we'll be able to send an SMS of detailed analysis to the user, especially in where they might not have good internet or access to such infrastructure for the app to work. This is a call for action. We seek funding and partnership if we are to scale this up and take it out there for people to use and benefit from this idea. We will urge every one of you to join us in saving lives. Thank you.